continue to look at some of the various surgical questions that we are likely to meet when we go take our licensure exams and see how best to go about them in terms of answering the question. To begin with, our first question for the day. Which of the following best describe the role of the circulating nurse? A. Manages the operating room and monitors activities of the surgical team. B. In charge of scrubbing and assisting in cleaning of the theater after surgery. C. In charge of setting up the sterile field or table. Before we can be able to answer this question, we need to borrow our knowledge back to theater nursing. You quite remember in surgery, specifically surgery 1, we have theater nursing that look at the various roles each theater team member plays. When you take theater nursing, the team is divided into two main divisions, where we have the sterile team members and the non-sterile team members. The sterile team members looks at the surgeon, the first assistant surgeon, and the scrub nurse, whereas the non-sterile team members looks at the circulating nurse, the anesthesia team or the anesthesia providers, the laboratory technicians, and the students or other people found within the operating room. These are the two various divisions of the surgical team, the sterile team members and the non-sterile team members. Now, the circulating nurse, being part of the non-sterile team members, one of their primary role is that they owe allegiance to the scrub nurse. They ensure that the operating room is very safe and that the operation that is being carried out goes on smoothly. These are some of the few functions of the circulating nurse. They go about ensuring that the instruments used for the surgery are readily available, they are sterile. Any instrument that is being used and is out of reach of the sterile team, they make sure that these instruments are closer to the sterile team. And so from this explanation, let us quickly look at the question back on the screen. They are asking us that, which of the following best describe the role of the circulating nurse? You will see that option A says that manages the operating room and monitors activities of the surgical team. From all the options spelled out there, that will be the best definition of a circulating nurse, as the circulating nurse will manage the operating room and ensure that the surgery that is going on is being carried out safely as a function of a circulating nurse. Next question. Theater techniques are practiced before any surgical procedure. Which of the following is the correct order in which theater technique is practiced? A. We have scrubbing, gloving, and gowning. B. We have gowning, scrubbing, and gloving. C. We have scrubbing, gowning, and gloving. This is also surgery 1 that we need to apply over here. In looking at this, they are basically asking us that before surgery, how does the sterile team members prepare for this surgery? What is the sequential technique that they use? You know very well that in the operation room or in the surgical theater, before surgery, one needs to do scrubbing first. And that's where you see the surgeons, the first assistant surgeon, and the scrub nurse going to the scrub sink to scrub for a minimum of 10 minutes before surgery. So scrubbing is the first thing that is done before any other thing is done in respect to beginning of surgery. After scrubbing, our next thing we are going to do is that we are going to dry our hands and then go and wear our gown. And so after scrubbing, you have gowning as the second phase or the second technique that any theater member should do. Right after gowning, that is where we wear our sterile gloves, which we call the gloving. And so the correct sequential process that follows in the surgical theater is scrubbing, gowning, and gloving. So per this explanation, you will see that per our question projected again on the screen, our best answer will be what? The scrubbing, the gowning, and the gloving, which makes option C the correct answer. Our next question reads, the period of time from when the decision of surgical intervention is made to when the patient is transferred to the operation room is referred to as dash phase. A. Perioperative. B. Preoperative. C. Intraoperative. This takes us again back to our beginning of surgery, where we will look at the perioperative phase, what it means, the preoperative phase, what it means, and then the intraoperative phase, what it means. Option A is talking about the perioperative phase. When we talk about perioperative, we are looking at the care that is being rendered before, during, and after surgery. That is what we mean by the perioperative phase. The care given to a patient before surgery, during surgery, and after surgery. And so the perioperative phase houses both the preoperative phase, the intraoperative phase, and the postoperative phase. That is what we mean by perioperative phase in surgery. The preoperative phase looks at what the nurse do to the patient before the onset of surgery. And that phase begins when surgical decision is taken. And so when the surgeon decides that, okay, we are going to have this procedure on this patient, right at the time the decision was taken, so they transfer the patient to the operation room, that phase is what we refer as the preoperative phase. Then from the preoperative phase, we have the intraoperative phase, which is also called the intra-op. This phase begins as soon as the patient is transferred onto the operating bed and ends when the patient is moved to the recovery room. That is the intraoperative phase. So putting the patient on the operating bed, anesthesia being given, the surgery being going on, this phase is what we call the intra-op or the intraoperative phase. The post-operative phase begins when the patient is received into the recovery room and subsequently transferred back to the ward. And so per this explanation, looking back at the question, they were asking us that the period of time when the decision for surgical intervention is made to when the patient is transferred to the operation room is referred to as what phase? The best answer here that defines this phase is the preoperative phase. And so that makes our option B our correct answer. Next question. Shuttle forceps is an instrument used to pick items from A, sterile field, B, non-sterile field, C, disinfectant. Back in our various nursing schools, specifically when you are doing wound dressing, there is a drum that contains a very long forceps, which we call the chisel forceps, which is being used to hold the green towel, which is a sterile towel, and open a sterile field. And so you knowing this, that a chisel forceps is used to dress a sterile field, you should also know that this same chisel forceps is going to be used to pick objects from a sterile field. And so per this explanation, going back to our question on the screen, you will see that the right answer is that it is used to pick objects from a sterile field, making option A the right answer. Next question, which reads, Mamagan Kafui, age 65 years, is scheduled to undergo a laparotomy at the Agotime Government Hospital. Which of the following stages of general anesthesia is Mamaga expected to go through? I, we have excitement. II, we have beginning anesthesia. III, we have medullary depression. IV, we have surgical anesthesia. They are seeking, or this question seeks to examine our knowledge on the various stages of anesthesia. And you know that back then in surgery 1, we have the various stages of anesthesia that every patient who is going to theater might go through. And there are basically 5 stages of this anesthesia that we are looking at. Where we have 1, which is what? The stage of beginning of anesthesia. We have stage 2, which is the excitement stage. We have stage 3, which is the surgical stage or the surgical anesthesia stage. And then we have the stage 4, which is what? The medullary what? Paralysis. As the stages of what? Anesthesia. The 4 main stages of what? Anesthesia. And so looking at the sequential phases of this anesthesia, the question is seeking to see our knowledge on how to apply it in answering the question. And so looking at the options given on the screen, A says that I, and IV. B looks at I, IV, and II. And C looks at I, IV, and III. The question is asking us to choose our answer based on the sequence that the patient will go through. And so the patient is going to go through the first stage, which is the beginning anesthesia. The second stage will be the excitement stage. The third stage will be the surgical anesthesia stage. And the fourth stage will be the medullary paralysis or depression. And so per this explanation, we will have no choice to have option C as our correct answer. Thank you. Today comes to the end of another episode on our Licensure Hub channel. I will urge all who just joined us to subscribe to the channel, like and share so that anytime we release a video, you will get notified. You can keep your questions in our comment section and we will respond to them appropriately. Thank you. See you on another episode of Licensure Hub. Bye.